Hey manual therapist, I just wanted to give you a quick snippet of information that can really help with those stubborn low back and anterior hip restrictions and pain syndromes. We're going to discuss a root cause of those that you may have never considered before. First, let's do a quick review. For those of you who have taken our structural dynamics class, you know that really tight, shortened and immobile hip flexor muscles and anterior hip muscles can cause lower back pain and dysfunction. Because as these muscles shorten, they pull the body into flexion, or at least the pelvis. Now, as our body's righting mechanism wants to keep our eyes on the horizon, it's going to have to bring us to stand us up crazier. We're going to have to tighten up the entire posterior chain muscles. Now, as this happens, you'll notice as I stand up, almost all of my lumbar extension is gone. Now, not only is that going to set us up for vertebral compression, chronic lower back pain and dysfunction, it's also going to cause a whole lot of other compensations in the body. For example, to hold this posture effectively and move, I'm going to have to really tighten up my anterior lower leg muscles, my shin muscles. I'm going to have to tighten my abdominals, my quadratus lumborum muscles to keep me upright. And then I'm also going to have a chronic head forward posture that's going to tighten up my SCMs, my scalenes, and my posterior cranial muscles. So what are we to do about this? Well, let me show you one thing real quick before I show you one of the real major causes of what can happen. So we're going to take a quick stretch that I learned from the Gray Institute with my training there about opening up the hip flexors. So what I'm going to have you do is internally rotate your right leg and step out into a lunge with your feet about shoulder width apart. Now we know if we can't just release a muscle, we also have to train it how to do its job. And each and every muscle goes through all three planes of motion. So if I'm loading up my hip flexors effectively, I'm going to just drive my pelvis forwards and backwards through a sagittal plane motion. Do this 5 or 6 times and then stay into the stretch. And then we're going to take your hip flexor in a frontal plane motion like this. Most people have a really hard time even doing this. And then let's go into a rotational motion, a little transverse plane to open that up. Now, if you've done that stretch, you can stand up and walk around now, and right away you're noticing that the whole awareness of your hip has opened up and you can get your leg further into extension right now. So as you can see, these anterior hip restrictions can cause all kinds of problems all over the body. Now that you know what that feels like to be loosened up, it can give you a greater appreciation for the work and the time that you spend in the anterior hip. But we can also take that a little bit deeper. So one of the body's main concerns is protecting our vital organs and our central nervous system. Oftentimes, from lack of motion, poor diet, or lack of emotional processing, the attachments of the ascending and descending colon can get restricted within the pelvis. If the restrictions around the large intestine aren't addressed, all of the great work that we're doing to restore motion in the front butt will not be nearly as effective as it could be. In fact, if more motion could lead to damage or strain or tearing in the organs, our proprioceptive and central nervous system is going to kind of shut down the motion to those areas to avoid injuries to one of the most vital parts of the body. So let me give you an example of how to work with and release these lower aspects of the ascending and descending colon to improve your function. So if I take my prop here as part of the colon, as it comes out of the small intestine here, just medial to the anterior aspects of the ileum, it's going to run up here before it takes a curve at what we call the hepatic flexure. So in function, as we go into extension, our colon is going to lengthen out, our ascending colon. And as we go into rotation to the right, it's going to twist a little to the right and to the left. So if we get some restrictions down here in the ligaments and some of the fascia that can get a little bit stuck around the lower colon, and also if we don't have any proprioceptive stimulation in there, the body is going to want to shut that down. So what we can do to release that is just kind of bend at your knees, not at your waist, but at your knees, and I want you to take both of your hands and kind of create a little bit of a scoop. and reach just inside your ilium and grab right there above your pubic bone. Just kind of reach in and grab the tissue of the colon and just pull up and give it a little bit of a stretch. Now, as soon as you feel that stretch, I want you to stand up and straighten your knees and go into extension. Then I want you to stand up and go into extension with right rotation. And then, of course, stand up, extension with left rotation. So do each of those movements 3 or 4 times and really get a nice sense of awareness down there in your colon. And get that all opened up. Get that released into extension. And now, notice once you've done that, just take a little bit of a walk for a second, and you're going to notice that your hip flexor group and everything around your quads, everything is kind of loosened up a little bit, and you'll notice that your proprioceptors have been stimulated so much, you're going to notice a little bit more stability on that side compared to the left side. So instead of being uneven, let's go ahead and do the left side as well. So there's a little bit different structure on the left side, so go medial to your hip, and just take your fingers in there again, bend your knees, grab part of that descending colon as it goes and turns in, and just give it a nice little stretch and a lift, and then straighten your legs and go into extension. Come back down, straighten your legs, go into left rotation, pick it up again and go into right rotation. Do that each time about 3 or 4 times to ensure a really good release in there. And then go for a little bit of a walk and notice how that feels now. You're going to notice a lot of awareness in your lower abdomen, and it's going to be much easier for you to go into extension. So you're going to notice with a lot of your clients and your athletes that their performance and their ability to have most stability or stability is going to be greatly increased by opening up the lower parts of the large intestine. If you want to learn more about the structural and functional implications of not only the large intestine, but of all of the organs, and how to utilize this with your clients for greater mobility, stability, and health, come to our Visceral Dynamics training. You'll learn a new way of looking at the viscera in the body from a structural, functional, and energetic perspective. Visit Trunamics.com and click on the upcoming trainings button to find the next class. We'll see you there.